A broken hip is the most common injury in older people that needs to be treated in hospital. It can reduce people's ability to walk and their independence. The injury can be very serious and fatal in some cases, so we are always looking for ways to improve the effectiveness of treatment. Certain types of hip fracture are best held in place with a screw, which is inserted into the thigh bone around the hip joint. However, due to osteoporosis, the bones of some patients are not strong enough to hold the screw in place, which means healing may not be as good, and some patients may need a second operation. The WHiTE 4 clinical trial, the largest study of its kind, asked if a new type of screw, the X-bolt, worked better for patients with a hip fracture. 1,128 people aged 60 years and older, treated for a broken hip in 10 hospitals across the UK, took part in the study. We used a process called randomization to split the people into two groups with similar demographics. Half were treated with a traditional type of screw, and half with the X-bolt screw. We followed up with everyone who took part in the study for a year after their operation. We found that there was no difference between the two types of screw in terms of quality of life, how well a normal life could be lived, walking ability, or the number of people who died. In both groups, approximately 3% of patients needed to have a second operation. Overall, we recommended that surgeons use the implant that is most familiar to them.